Healthcare careers shouldn't be a mystery, and they shouldn't be reserved for people who already have connections or know the right people. My name is Tanvi, and this is Healthcare Unveiled, where we have honest conversations with healthcare professionals about their real journeys, the good and the challenging parts, so that you can figure out if and how this path works for you. Thank you, Dr. Latshaw, for being here today. Can you tell us a little bit about yourself to begin?
Sure. So, my name is Weil Latshaw, and I grew up outside Philadelphia. Always loved science growing up, was a little bit of a nerd. But I like to think I was a fun nerd. And when I was in seventh grade, I had a subscription to like Science for Kids or something, and every article in it was about, it said like Johns Hopkins University. So I decided in seventh grade, I wanted to go to Johns Hopkins and I wanted to cure cancer. So I ended up at Johns Hopkins. I did not end up curing cancer, but I studied biology there and ended up actually sticking around after working for a bit and getting a master's and a PhD, and then worked for a bit more and came back, and now I'm on faculty. And I live in Baltimore, and I have a 16-year-old daughter.
So I'm not sure if you mentioned this just now, but when I was doing the Johns Hopkins Global Leaders Conference, you mentioned that you were in environmental health. So for students listening who might not know, what exactly is environmental health, and how would you explain what you do day to day to a student that's considering this field?
Great. So environmental health is the field that looks at how our environment impacts our health, whether it's the air that we breathe or the water that we drink or the food that we eat or even the neighborhoods in which we live. Everything around us impacts our health. And so the field of environmental health tries to get entire communities of people to be healthier by changing our environment.
Sorry.
Go ahead, yeah.
I just wanted to ask, how did you kind of learn about the field of environmental health?
I totally stumbled into it. So I was a biology major, and I did not want to be a doctor. I don't like blood and just knew I couldn't do that. So I thought I would end up in a laboratory doing cancer research. But the more I worked in laboratories, the more I realized that it wasn't for me, that I'm very extroverted. I like talking to people. I like being out in public and public speaking. And I also sort of want results that are a little bit faster than what you tend to get in the laboratory. So I ended up working at an insurance company, which surprises a lot of people because they're like, well, how did that happen? Because I knew I didn't want to go to med school and I didn't want to work in a lab, I kind of just showed up at any careers office session that was interested in biology students. And Travelers Property Casualty was interested in biology students, and they ended up hiring me, and they hired me to handle environmental and occupational health claims. And so that was my first introduction to environmental health, but I didn't even know the term environmental health. So for 2 years, I worked at this insurance company and I handled environmental health claims. But that wasn't what I wanted to do the rest of my life either. I felt like I wasn't making the world a better place through these insurance claims. And so I went back to an old professor and I was like, I want to make the world a better place and I want to use biology to do it. And I told him what I had been working on. He said, well, you should do public health. And I was like, oh my gosh, the people who live in tents and give vaccines, they're amazing, but I need hot water and, air conditioning. And he was like, okay, you have no idea what public health is. So he introduced me to somebody at the School of Public Health. And then when I went on their website, I saw they had an entire department called environmental health. And it was all stuff that I had worked on for this insurance company. It was, how like water contamination and lead poisoning and asbestos leading to lung cancer and mesothelioma. And so I kind of felt like I found like my field, like I was going to be able to influence the health of populations through changes to the environment. And so that's how I stumbled into it.
It's amazing. Thank you.
Yeah.
How did you notice environmental health kind of affecting your local community, and how do you think that might apply to larger communities?
Great question. I am looking out the window. I'm here in Baltimore, and I can see our incinerator from my window here at the School of Public Health. And I'm also looking at Baltimore's Inner Harbor, which is, a waterway that has been so contaminated in the past, you weren't allowed to swim in it. And now we do have people who swim in the Inner Harbor. They have an event every year. And so there's a lot of environmental health issues in everybody's communities. You might just not think about it as an environmental health issue. Um, a lot of communities have old landfills or maybe old hazardous waste sites. So you can go to EPA and you can type in your zip code and it will tell you like what hazardous waste sites are near you, or it will tell you which industries are sending pollution into the air or the water. And so I encourage everyone to take a look at EPA's website and see what environmental health issues are impacting their local community.
Thank you.
Mhm.
And by looking at these issues, how do you think that people that are, for example, in high school could potentially try to address these issues?
Yeah. That's always like, it's like, where do I start, right? Like, I want to make a difference. I want to do something. There are so many nonprofit organizations that are already out there in the world. You don't need to start your own usually. You can find one in your local community. So I would just say, wherever you live around the world, maybe type in your town or your province and maybe the words environmental justice or environmental health. And hopefully you'll see maybe some articles about things going on in your community. And usually they'll reference like um, the Clean Air Network of Detroit or something like that is working to address, asthma in children in schools in Detroit. And you might be like, oh, let me write to the Clean Air Network and see if they need volunteers. And so nonprofits are usually they usually don't have a lot of money, especially if they're local. And, to have a high school student to help them work on their website or a high school student to help them coordinate a community meeting or get the word out on social media, or maybe to do some research, to do some background research, like how long has this issue been in the community and when did it start? And what is this chemical that's being released? What health effects is that linked to? Students can kind of do some of that background work and really end up helping and making a difference.
Thank you.
Mhm.
You mentioned that you were both a student and now work at Johns Hopkins, which is a very cool journey. So what drew you to stay at Hopkins for so long, and how did you transition from student to faculty?
Yeah. So, yeah, like I said, in seventh grade, I was determined I wanted to go to Johns Hopkins, and I'm so excited that I made that happen. I have imposter syndrome, like a lot of I think maybe younger folks might feel, but even at my level, I still feel like, oh my gosh, how did I get here? This is fantastic. Um, so when I applied to Johns Hopkins, it was kind of a reach school for me. And my college counselor said, you better have a backup plan. And fortunately, I didn't need one. I got in and was able to. At first, I didn't think I could attend because I didn't think I could afford it. And I wrote to the financial aid office and they said, we have some extra grant money that we can give you from Michael Bloomberg, I think. So I'm really grateful for that extra grant money that made it possible for me to come. Graduated from undergrad, worked at the insurance company, went back to this professor and said, what can I do? And he said, you should look at public health. Well, Johns Hopkins has the #1 school of public health. And so I was like, well, I wouldn't have to move. I'm already located in Baltimore. I talked to people on faculty at the school and I really liked them. And so I, of course, applied to Hopkins and I also applied to one other school too. But when I got in, it was kind of easy just to stay here in Baltimore and to go to the #1 school of public health. So that's how I ended up staying at Hopkins for graduate school. And then after graduate school, I worked for 15 years in Washington, D.C., doing federal policy, national policy. But it was a long commute from Baltimore. And I kind of hit the ceiling of where I couldn't really advance anymore at the organization where I worked. So I came back and talked to my old advisor, and I was like, I don't know what I want to do. And I ended up meeting the chair of our Department of Environmental Health. And she and I had a conversation, and I followed up with her, and we set up a time to meet, and we chatted. And a week later, she offered me a job to come back and run the master's programs here. Um, and it was amazing. I always wanted to, I love Hopkins, especially the School of Public Health. The people here are nice and smart and hardworking and committed and passionate. But I never thought I could get a job here because I'm not really interested in research. I'm more interested in how do you take research and change the world, like the translation. And so when she hired, Hopkins is all about research. So I just never thought I could get a job here. And here I am. I got a job here, and there wasn't a job posting. A lot of things. So if you'll give me like a little bit of a chance to diverge,
Of course.
this one story I love to tell about like career paths, and my best piece of advice for young people like you. It's always good to have a plan, but it's also always good to be open to diverting from that plan. And here's my little story. So after I got my PhD, I was at a dinner, and I was sitting next to the deputy director of CDC, the Centers for Disease Control and Prevention. And I was so nervous. And I was like, what am I going to say to this guy? I should talk to him. And the best thing I could come up with at the time was I said to him, so to what do you owe the secret of your success? Which is so cringy now. But he was really sweet. And he said, I was a prepared opportunist. And I didn't really know what that meant. So I probably looked at him a little funny. And he said, I always had a plan for what I wanted to do in my career, but I was always prepared to take advantage of opportunities that presented themselves to me. So my job right now was not something I was looking for. It wasn't part of my plan. But after a random conversation with, the chair of the department, I ended up being able to do this job, and I love it. So
It's amazing. Thank you. So you said that you now direct a master degree program. What do you tend to look for in applicants, and what makes someone stand out over just good grades?
yes, absolutely. So we do look at the whole applicant. So I do admit students with grades that aren't stellar. I've admitted students with a 2.74 GPA. Those students that I've admitted that didn't have stellar grades, in some cases, maybe they had things that they struggled with. Maybe during college, they had to have a full-time job to pay their way through college, or maybe they were taking care of their sick parent who, needed a full-time caregiver. But in each case, the person with the not so great grades had just such examples of leadership potential. They were activists in their community, or they were just amazing writers and had a clear vision for what they wanted to do with their life. And so I have tips that I always give students when they ask me about making a good application. So the first tip I say is when you're working on your statement of purpose, sometimes called an essay or a personal statement, what we want to see is we want to see insight into who you are as a person. We're already going to have your transcript. So we're already going to know what classes you took and how you did in them. So don't rehash that. We're already going to have your resume. So we're already going to know what jobs you held. What we really want to see in your statement of purpose is what motivates you? Like, what do you want to do with your life? And how does this degree program fit into that? So we want to know your personal story. Growing up, I always was interested in blah, blah, blah. Or, and you can talk about maybe some of your jobs or some of your classes, but talk about them in terms not of the grade that you got, or the laboratory methods that you used, but talk about them in a way that shows your evolution. When I was little, I really loved biology. And then I started to learn a little bit about the environment. And then I started to see the connections between the environment and health. And then that brought me to this master's degree program. And, the master's degree can help me along my journey to become a physician who focuses on environmental health issues or something like that. So kind of show your evolution. So that's my first tip. My second tip is around the letters of recommendation that you have to get. So I always see like a range. At the low end, I get a letter that says, I had this student in my class. They got an A and they turned in their things on time. And then at the top end, I get multiple pages that talk about, I had this student in my class, and every day after class, they stayed back and asked me questions that showed that they were thinking about the material in a very deep way. They asked if they could work with me on a project. So, I had the student, develop a literature review on this, whatever, what you want. And the way that you get to the better recommendation, the more detailed, more personal recommendation is there's a couple ways. One, get to know your teachers, right? Go to their office hours, talk to them, raise your hand, participate during class, ask questions. During class, like nod at them, look at them, engage with them, show that you're interested in the material. The second thing that I think is going to lead to a better letter of recommendation is actually crafting talking points for your recommenders. Because as somebody who writes a lot of letters, I'm busy. We're all busy. And so if you ask me to write a letter, I'm probably going to look through my emails to see if I ever got any emails from you. And I'm going to look at your grades. And I'm going to probably write the most basic letter there is. But if you send me talking points and you say, Dr. Latshaw, remember I came to every office hour you held? Remember after class we had that long conversation about this toxic chemical? Remember that I, chose to write my paper on this experience? So you should remind your letter writers of all the great things that you've done. And then the last piece of advice when it comes to the letter writers that I'll share, and then I'll let you move us along, is some letter writers just have a string of adjectives. Like Tanvi is smart, passionate, creative, a team player. But what a reader really wants to see is examples of that. So instead of just saying Tanvi is, a team player, you want your letter writer to say, Tanvi is a team player, and I know that because during group work, during class, she came to me and talked with me about one of her teammates who was, not pulling their weight, and we discussed how she could diplomatically nudge this teammate to step up her game. And I saw her helping her teammates understand some concept that was difficult to grasp. So you want to give examples. You don't want to just say an adjective and then leave it at that. You want to say an adjective and then give one or two examples of where the letter writer saw you doing that.
Great, thank you. That was really good advice. So talking a bit more about your academic journey, what was graduate school like for you, and what were the biggest challenges that you faced as a student?
Graduate school was amazing. I feel like when you get to graduate school, hopefully you're at this point in life where you have found your people, where you have found your niche. Like every single class in grad school, I was excited to go to. Like I just felt like I am learning the coolest stuff, the most important stuff, that is going to help me make a difference in the world. And so even though grad school, especially at Hopkins, so Hopkins is on a term system, the School of Public Health, instead of a semester system. So instead of teaching a class over 4 months, like a semester, we squash it down into 2 months. And that means that our degrees are very fast. You can get a master's, 64 credits in 1 year. But it also means the classes are very fast. So you just have to keep up. It's almost, but because I loved the material so much, it never felt that bad. And because the faculty here are so nice, I always felt like I could approach them and just say, oh, I'm completely lost. I need your help. And didn't feel like, And I also felt like I made some of my closest friends in grad school. I could go to them and I could say, did you understand like this last lecture in biostats? Like I'm kind of confused. And my friends would help me and we would study together. And then we would go out together after the exams and we would go get dinner and have a drink. And so grad school was just an amazing time. The challenges of grad school was probably just being a poor student. At that point in my life, my parents said you're off on your own and, had to take out loans to cover grad school. And I just remember like writing checks for my rent each month and like praying that like I would get my deposit from my loan before they would write like cash the check and just that was a struggle during grad school.
Talking more about that, for students that are worried about the cost of either like undergrad or graduate school, are there like funding opportunities, assistantships, or any other ways to make these programs more affordable for students?
I mean, each school and each program is different, right? So like for our department, we have a funding guide for master's students that is a list of scholarships that are out there. And if you get into our master's program, I'm willing to help you apply for scholarships. I'll look over materials for students. I'll write a letter for students to try to help them find funding. Having said that, the majority of the students in our master's programs do take out loans to pay for their graduate degree. And if you're like me, I was always trained never be in debt. Don't if you use your credit card, you pay it off right away. Like you don't carry debt. So when I was signing my loan for my master's program, it was stressful. I couldn't believe the tuition at the time was $40,000. And I had been working at this insurance company and I was making $30,000 a year. So I was like, I'm signing a loan for more than I make in 1 year. And it wasn't just tuition. I had to take out a loan to pay for my rent and pay for food. And at that point in my life, I also thought, well, should I be using this loan to put a down payment on a house instead of getting a degree? It was so stressful. But after I graduated and got my master's, my first job, I was making $50,000. So I went from making $30,000 to $50,000. So it was a $20,000 difference, which is amazing. And if you think about tuition was $40,000, I could have paid off the tuition part of the loan in 2 years with that extra $20,000. Now, I didn't because I was like, woohoo, I have a little extra money now. Like I can, go out to dinner again and buy some new clothes. And also it wasn't just $40,000 in that loan. It was, a lot more than that. But my point is, I try to tell students to think about, at least for our degrees, they do pay off, right? It is an investment in your future, not necessarily debt. And actually, I ended up doing like a little study because I kind of felt like, what if I was just lucky and I made that extra money, And I asked all of our grads, like a couple years back, what were you making before you got your master's and what were you making when you graduated? And the average increase or the average change was 87% higher salary. So in other words, it does pay off. And then I also asked another question. I said, what are you making right now in your career? And the average change was 450%. So even though you might have to take out loans, in the end, at least from our experience here at Hopkins, it pays for itself.
Yeah, thank you. You mentioned translating science to policy and practice as well with your work. So can you give us like a concrete example of how your work has made a real world impact and what success looks like in this field?
Sure. So my favorite story, maybe the one that I'm most proud of that happened most recently is work on transit equity in Baltimore. And so I tell this story when I started working at Hopkins, I was really excited to finally to be able to really engage in local community. Because when I worked in DC, I really didn't have that aspect. I was so focused on the national level. I didn't really engage with local communities. So I thought, okay, I'm going to be at Hopkins in Baltimore. I'm going to get to work with real like communities that are worried about environmental issues. So I went to this environmental justice meeting, and somebody introduced me to Mr. Samuel Jordan, who was the president of the Baltimore Transit Equity Coalition. And for the first 5 minutes after he got introduced to me, he railed against Johns Hopkins and talked about how horrible our transportation policies were. And at first I kind of felt defensive. I was like, this is my, like, I work there. Like, don't like, attack where I work. But then by the time he finished, I was kind of like, yeah, you know what? You're right. Our policies do kind of stink. And he was a little surprised, I think, that I agreed with him. But then I was like, yeah, but I can't help you. Like, I'm just this, like, I just got hired as I'm like this lower level faculty person. I don't have any impact on Hopkins's transportation policies. I don't even know who I would talk to about the Hopkins transportation policies. But then I felt bad because I thought, like, I've always talked about how important it is to try to answer community needs. And here I am telling this person I can't help him. So I said to him, I'm like, well, maybe I could help you collect some data. And he was like, oh, that would be great. And I was like, oh, geez, I don't really know how to do that. And then he said, I want you to make 4 maps for me. And I was like, oh, geez, I definitely don't know how to do that. But again, I didn't want to tell him no, because I wanted to, like, I wanted to find a way. So I recruited an undergraduate student to help apply for funding to make these maps. And I kind of thought we wouldn't get it because I had never applied for a grant before, and this undergraduate had never applied for a grant before, and we got it. And I was like, oh my goodness, what am I going to do? Like, now I have somebody who's actually looking over my shoulder, expecting me and giving me money to do work that I don't even know how to do. So I kind of was really nervous and freaking out. And I reached out to somebody here at the school who makes maps. And I said, I have this little bit of money. It was like $20,000 or $30,000, most of which I wanted to give to the community group, because community groups often don't have any money. And then here we are, at Johns Hopkins, and we make a salary, and, I'm applying for a grant for this money, and I don't want to take the money. I want to give it to the community. So anyway, so I said to this person, Frank Carrero, do you think you can help me make these maps? And he said, well, I can't. He said, but we do have somebody who can maybe help you for free. I was like, this is great. So we kind of pieced together a team. There was somebody from Morgan State, which is up the road, who had done similar work on biking equity, and they had made maps about that. And there was somebody in Florida who worked on transportation policy. And so I basically put together this team, and we met every Friday for a year, and they made the maps. I didn't make them. I don't know how we made them, but every week I would say, what do you need from us to make these maps? And every week they would say, I need this data and that data, and we would make decisions. And so Mr. Jordan took these maps to our state legislature, and Delegate Ruth, in the Maryland General Assembly, introduced legislation based on these maps called the Transit Equity Act. And it ended up passing, not in the first year. I think it was in the second or third year that it was introduced. And an early draft of the law actually referred to our report that we made. And so the law now says if you're going to make a major transportation policy change in Maryland, you have to do a transit equity analysis like we did. So that influenced policy in Maryland. And also the U.S. Department of Transportation, right around this time, put out a call for information. And they said, does anybody have methods on doing a transit equity analysis? And I was like, we just developed methods on how to do a transit equity analysis. So I submitted our methods to the U.S. Department of Transportation, and they ended up creating a website that had all of these maps for the whole U.S. with very similar data that we had used in our maps and our report. So I kind of like to think that we also influenced U.S. Policy. And then to kind of bring it around full circle, and then I'll stop. When I first met Mr. Jordan, I said, I don't know who at Hopkins I would even talk to about transportation policy. Well, fast forward a couple years back, I was asked to co-lead a new sustainability plan for all of Johns Hopkins. And guess who I got to work with? the head of transportation at Hopkins. And so in the new sustainability plan at Johns Hopkins University, we now have a transportation section. And we have changed some of our policies here at Johns Hopkins. And it kind of goes back to that initial conversation with Mr. Jordan. And Mr. Jordan just passed away this month. So I am just really grateful that I got to work with him on this and make a difference and take science and data and information and translate it to policy change at Hopkins, in Maryland, and in the US.
It's really inspiring. Thank you. I meant to ask this earlier, but you're bringing up a lot of different connections with, for example, Mr. Jordan, and you talked about your advisor a lot. And I feel like in healthcare in general, connections are just very important into getting in the field. So how would you recommend building those connections in that network of people?
Oh, networking is so important. My students roll their eyes because they hear me say all the time, 80% of all jobs in the United States are through networking. And so you better be building your network as fast as you can. Have a LinkedIn page. And anybody you run into, whether it's listening to this podcast, you can now connect with me on LinkedIn. Anybody listening to the podcast can connect with me on LinkedIn. Connect with your friends, parents, connect with your uncles and aunts and your cousins. Connect with anyone, because you never know who is going to know someone who works where you want to work. And then what you do, if you say to yourself, I want to get a summer internship at Johns Hopkins University, then you go onto LinkedIn and you type in Johns Hopkins University, and then you click people, and then you click first connection, and hopefully you know someone who works there, and you can say to them, hey. Now, I always tell my students, do not start off an email or a conversation saying, hey, I want a job. Hey, I want an internship. How can you help me? Because that just seems, it's too much about how can you help me? Right? So I always say, if you're going to reach out to somebody, reach out to them and say, hey, I'm really interested in your career path. Would you be willing to chat with me about how you got where you are? And if you're telling somebody that you think they're interesting, they're probably going to be like, oh, wow, I'm interesting. And they'll probably say, sure, I would be more than willing to chat with you about my career. So then you set up a time to chat with them, and you ask them questions. Like you're asking me right now, how did you get where you are? What do you like about your job? What's the biggest challenge? And then at the very end, you say to them, I'd love to get an internship at Johns Hopkins this summer. Do you know of any programs? And then hopefully they'll connect you to somebody or send you some links. And and then you can also use second connections on LinkedIn, and you can say, maybe you don't know someone who works at Hopkins, but maybe your aunt does. So you could write an email to your aunt and say, hey, I see you know Dr. Latshaw. Would you be willing to introduce me to her? Because I want to talk to her about her career path. And then say to your aunt, here's some language you can use to introduce me, because you want to make it easy for your aunt to make that introduction. So all your aunt has to do is hit forward on the email, and she would send it to me. So that's how to sort of build a network.
Yeah, thank you.
Mm-hmm.
One of my dream schools is Hopkins, so I was just wondering, and I know for a lot of kids that want to pursue healthcare, Hopkins is obviously their dream. So do you have any tips for high school students that are applying either this fall or in the next few years?
I gave you the tips, I think, for, the application. One of the things that we look for, at least here for our master's programs in the Department of Environmental Health, is science and math classes, and how you did in those. Mainly, I look at biology and chemistry, calculus and statistics. So if you have those classes and you've done pretty well, I think some students think if I don't have straight A's, I'm never going to get into the Hopkins School of Public Health. That is not true. I told you before, I've let in, students with a 2.74 GPA. So A's and B's are perfectly acceptable in those classes.
Thank you.
Mm-hmm.
Thank you so much for being here today. I learned a lot today. And for listeners, to close off, for listeners who are now interested in learning more about environmental health or planetary health, what resources would you recommend books, websites, or organizations may be to follow?
I love that you brought up planetary health, Tanvi, because this is like my new passion. So environmental health, I sort of described to you, but there's this new sort of field that's very much related to environmental health. And it's the idea that if our planet isn't healthy, we can't be healthy. And so it takes environmental health like a step further. And it talks about not just like our air, water, and soil, but it also talks about like biodiversity and ecosystem health. And so the Planetary Health Alliance is an international it's an international organization, has over 500 members in more than 80 countries. And they have a next gen network for youth. And so I think that's a great thing to join. And they have hubs for each region around the world. So you can join like the North American hub that's just being brought about. And there's also a National Environmental Health Association here in the US that I think has student memberships that you can join. And the American Public Health Association has an environment section, and you can join APHA as a student member. And the environment section always has projects and always has things that students can help out on. So not only can you join, but if you're willing to do some work, they'll probably be willing to give you some work to work on, and then you can get experience and they can get, some things done. So
Great. Thank you so much for being here today, Dr. Latshaw. Your story is very inspiring, and I learned a lot. And I hope anyone listening also took something away from today's episode. So thank you so much.
It was great talking to you, and best of luck, and hopefully you'll keep in touch.
Thank you.
Great. Thanks so much. Take care.
Thank you, you too.